As a Hispanic living in Puerto Rico, sometimes we feel that we are a minority inside a minority. My name is Tristana. I was born and raised in Puerto Rico. I went to the hospital because I was suffering a pain. The kind of pain that gets you to the hospital, you know? It was like 2 weeks that I had that pain. They left me at the hospital several days, and we waited for the colonoscopy. I have never done before a colonoscopy because of my age. I was 38 at the time. Well, they found out after the biopsy that I was an adenocarcinoma, that it was a colon cancer. At the hospital, I was diagnosed with stage 1 because everything looked great. It was 3 months later after we did the PET scan that we found the metastasis on my lung. I was shocked, terrified. I was afraid, like a complete silence when you do not hear anything else, nobody else. And then a couple of days later, maybe a week after my tears were all dried up, well, and then I take matters in my hands and start looking out what was the best thing that I could do. First, it was the surgeries. The first one, it was the colon surgery. And then when it was discovered the metastasis in my lung, it was the thoracotomy. So for me, it was important because I wanted to get out of the cancer cells out of my body. If that was an option for me, I wanted that. Then after that, I had a treatment, and is a combination of several chemotherapy drugs. It was hard. It was completely, sometimes unbearable. Some days I didn't know if I was gonna die because of the cancer or because of the treatment. Besides my treatment, my nutrition, it had to be spot on. My movement, the time and the quantity and quality of my rest, asking for help, Reiki, teas, meditation, prayer, whatever you choose to do. Today, I'm almost out of the woods, but I still have carrying with me the effects. Me and my family. Colorectal cancer, it's the second cause of cancer death in Puerto Rico. And I do think there is an apprehension in the Hispanic community, specifically Puerto Rico, I can talk about it, to not get screened when it's preventable. Most of the cases, this disease is preventable. So it's important to not be afraid. We tend to just feel unwell and then go to the doctor when we cannot do anything else. Knowing whatever you have and attacking it and dealing with it at an early stage, it's gonna get better results. I'm born and raised in Puerto Rico, like I told you at the beginning. And sometimes we feel that we are a minority inside another minority. We are Hispanic, but we live outside the mainland USA. I know that there are a lot of programs that need to be created and done. But for us right now, Hispanics living in Puerto Rico, we need the ones that are already currently up and running, we need to get them here. We need to be available to have more clinical trials, more research, more programs in the state level, municipal level. You know, not only to the Congress, obviously, but also to the lawmakers here in Puerto Rico. It's important that we need to be seen.